This interview describes the pathway to partnership between the Missouri Department of Health and Senior Services and Black-owned community organizations working to improve disparate maternal and infant health outcomes, including both the initiation and duration of breastfeeding. Joined today are Hakima Payne, Brittany Tru Kellman, Lisa Schlientz, and Cara Lawlor. Hakima Payne is the executive director at Uzazi Village, a pregnancy care center and nonprofit located in Kansas City, Missouri. Brittany Tru Kellman is the executive director and staff midwife at Jamaa Birth Village, a maternal health organization and nonprofit located in Ferguson, Missouri. Lisa Schlientz is the state breastfeeding coordinator at the Missouri Department of Health and Senior Services. Cara Lawlor, from the Health Communication Research Center, sat down with these three women to hear their journey to partnership. This partnership was made possible with funding from the CDC State Physical Activity and Nutrition Grant. Further efforts have been funded by the Association of State and Territorial Health Officials Breastfeeding Innovation Grant. This partnership could serve as a model for future work for maternal and child health.
Well, that's a long story, but my background is labor and delivery nursing. I also taught labor and delivery nursing for various nursing programs, but I have a long-standing passion for maternal and infant health, especially working within Black communities.
My journey has been also very long, and has some similarities to Hakima, but I got into this work as a mom, as a teen mom who really did not have the best experiences with pregnancy and birth in the hospital system. And after 2 negative birth outcomes, I have 2 beautiful children out of those births, but after, them really having negative outcomes and having C-sections, I really found my way into natural health and wellness and became a women's holistic provider, and really began to support other women through healing in the community. And after that, I had a very reclaiming 3rd birth where, the positive, beautiful outcome, all because of the way that I wrapped myself in traditional and cultural maternal health and wellness. So after that experience, I was called to be a midwife, called to be a doula. I began doing that work, and fast forward many years later, I'm now a midwife in the community and providing care at Jamaa Birth Village.
Tru and I met, I believe it was 2015. I was walking across the state of Missouri to bring attention to Black infant mortality. And Tru somehow heard about it. She'll have to tell how she heard about it, and reached out to me and asked to walk for a day with me. This was like a 2-week walk. So we made a date to meet at some obscure place along the Katy Trail. And Tru showed up. She was there when she said she'd be there. We walked that day. We talked. It was like we had been friends forever, and we've been joined at the hip ever since. So
yeah, that was an amazing day, Hakima. Like, I had no idea. Like, when we met, I had told you about I'm a student midwife and I'm doing these things. I'm a breastfeeding counselor, and I had these grand ideas, and I was really looking for support and validation because, like Hakima said, we were both on these paths simultaneously, but didn't know each other, and it felt so alone. And together, since me and Hakima have met each other on that trail, we have blazed so many other trails. I'm saying, like, whether it was together or whether it was alone, and we're just like rooting each other along the way, we have really, really done such great work for our community. And it's not about us, necessarily being commended for it, but it just feels good to know that we have each other, and that we also have the backs of our community members. And I just have this grand vision that even though we're on the opposite side of Missouri, like somehow this is all going to meet in the center, and just really this vision that we've been carrying is really going to manifest, and we're going to be able to see that together. So so happy, Hakima, that we still rolling, you know?
Oh, we are still rolling, girlfriend.
Yes.
And I love that we have really supported one another through our highs and lows. You know, when we have a victory, you know, we're the first we call each other.
Yeah.
And when something really bad rolls out, we're there for each other for that too. So that just means everything. You know, I know I've got somebody who's got my back, and I've definitely got yours. And it's been a beautiful, amazing sisterhood and friendship. So, in a variety of ways, at Uzazi Village, we're in Kansas City, Missouri. We have a community-based doula program that works with moms we recruit the doulas from our community, we train them, and then we pair them with mothers from the community. And then we offer a lot of wraparound services that go with that doula service. But that's the primary way in which we have an impact.
And for us at Jamaa Birth Village, it really started off, you know, as like a community involvement where it was many different women who were moms and who wanted to help make sure other moms of color, particularly Black moms, had support, knowledge, and resources that they needed to continue on in their journey in being mothers. So, and that we started off with education. And so we're rooted in culturally relevant education through whether it's childbirth education, parenting education, training for providers in the community. And then it has beautifully blossomed into a care model. So we provide comprehensive maternal health care through midwifery care, doula care, lactation services, mental health care, a lot of different wraparound options. A lot like Uzazi, we are really just focused on not just filling the void in the gap, but re-implementing the normal cultural presence of having everything that you need within your own community without having to go all the way to the suburbs or another area to get things that women deserve, want, and need. So in just doing those normal, natural things, we have been able to positively impact women in our community and eradicate birth disparities for the women and families we serve.
So I have been in this position with this state for about 4 years now. Prior to this, I actually worked in several local WIC agencies in Missouri. And I became aware of HAKIMA'S work, in fact, when a colleague of mine went to the Chocolate Milk Cafe training. So HAKIMA'S kind of been on my radar for a while. But what really sparked my interest in this work was attending the United States Breastfeeding Committee's coalition's convening, or their big conference that they have. And I went in expecting a breastfeeding conference where we talk about, you know, like normal nipple trauma and preterm babies and that kind of thing. But what I got instead was this really fantastic experience where we talked about racism, and we talked about health disparities, and we talked about inequities. And that was a very new field for me and incredibly interesting. And it really brought to mind one of the things that USBC has really focused on is when we are designing health programs, we need to be designing them through that lens. If we're not affecting the groups that are at highest risk, if we're not designing our programs to help those groups, then we are doing this work incorrectly. Now, there's a big difference between hearing about something at a conference and putting it into practice. So when the CDC SPAN grant became available, we started with a lot of our statewide breastfeeding initiatives, rolling them into that. We started adding in training, and I said, you know, I know we have limits on what we can spend with outside contractors, but I really would like to do an equity piece with this. And so we came up with a really great idea to give scholarships to women of color who wanted to sit for the lactation consultant exam so that we could have more lactation consultants supporting those communities and have that great culturally competent or culturally congruent care. So I called Hakima to talk about it, and she said, "That's a dumb idea." It might be the dumbest idea I've ever heard, Lisa. And I feel like that was a defining moment in our relationship because we're not used to hearing at the state, "Oh, I hate your idea. That's terrible." Right? But it was a moment where I kind of stepped back and said, "Okay, well, I've got some money. What do you think that we should do with that money?" And I think that's where our partnership was really born and where we started to build that trust. And Hakima's idea was much better. So we are working on still getting our lactation supporters of color working in those communities, but in a way that is much more supportive of their training so that they have that ability to do the work and to get paid to do that work. So there's always been some disparity in breastfeeding rates, particularly in initiation rate between African American women and other races. And for so many reasons, so many of them are socioeconomic reasons. It's about a 10% gap. So when we looked at our Missouri rates, about 86.9% of white women initiate breastfeeding, and about 77.7% of African American women initiate breastfeeding. I will actually let Hakima address some of the reasons for the differences because I think she's much more capable of doing so.
I think you're right, Lisa, that the reasons for that are very multifactorial and cut across, huge stratas of society and human interaction. A lot of it is social, some of it, or socioeconomic, some of it is community-based, some of it is historic, and some of it is embedded in structural inequities. How Black women just don't get the same time and attention and commitment to success with their breastfeeding goals as other women might. So there is a difference in how they're perceived. I feel like I've been on a lot of calls this week about this very topic. Of course, it's World Breastfeeding Week, so breastfeeding is a big topic this week. But if a nurse believes that Black women don't breastfeed, then there's going to be some hesitancy on the nurse's part to invest the time needed to really sit with the mother and to work out the kinks, and she won't invest that personal time, one-on-one assistance if she doesn't think the mother's very committed to this. Because I've been a nurse on the floor, and breastfeeding assistance is very time intensive, and the nurse's time is she has to make decisions about how she's going to spend her time. So and then mother may not get support amongst her family members or in the greater community, in her church community, or at her work site. She may not be allowed time to pump. So it's all sort of tied together. If she's at the lower end of the socioeconomic ladder, she may not have those workplace supports where women who are more white collar or administrative type jobs may have the full support of their employer, may be given a place to pump, may be given supplies to pump with. It can be very different on the support scale. The support of the partner is a really important factor in breastfeeding success. For Black women, maternal support, so support of their own mothers is really important too. So there's just a lot that goes into the disparities around breastfeeding initiation and duration rates for African American women, but generally speaking, the support that's needed to make that happen isn't always there.
I think one of the things that I picked up at USBC, one of the most important things, is that we do need more lactation supporters of color, but I can't fix that problem on a state level. That is something that we have to recruit from the community, and that's part of why we went looking for community partners. Also because Hakima's involved with the Missouri-Kansas Black Breastfeeding Coalition. And so we do try to seek out coalition partners or groups of people to work with. And so we talked to Hakima first, and Hakima brought Tru in, which was excellent because now that hits both of our really major urban areas in Missouri, which just made for an excellent partnership. And we're working on extending that partnership down to the Boot Heel and to other parts of Missouri to build this community support. So Hakima mentioned you have 2 interns, and they're on the Pathway 3, correct?
That's correct. They're on Pathway 3. So through our program, we are assisting them in getting their 90 hours of continuing education, which actually is coming from you, Lisa, a great deal of that, since the state is hosting some free training around the state. We've hooked them into that, but they're also getting their 500 hours of mentorship through us, and that's the main portion of what we provide, so that 500 hours. And that includes a lot of personal mentoring with our IBCLC mentor, as well as working with local institutions that we have relationships with that will allow these interns to do the bulk of those 500 hours in the local hospitals when they're ready for that part. So it's a long process, a good 1 to 2 year process to get them through this program. We keep a tight hold on them and walk them through every aspect of that journey so that they, never feel alone and never get lost, because it is a very cumbersome journey, all the requirements to become IBCLC. So we're excited. We're actually hunting for a 3rd and 4th, hoping that this will continue in years to come. But our interns are doing fantastic.
And so, on a wide level, when we think about getting 2 people through a program, that may not sound like a lot, but think about the impact that those 2 women will have on their community. They will have years of helping mothers with breastfeeding, and they will be mentors for the next crop of lactation supporters. And so that's what we're really hoping for here, not just to get 1 or 2 people to certification, but to create and build this structure so that it's easier to find mentors to work with, so that there are people who are invested in this work.
Well, for me, that's really easy to answer. I think Lisa has been really gracious and long-suffering and has really demonstrated commitment. When I came back to her with the idea of using funds to support our lactation consultant mentorship program, she was really open to that idea, and those women are thriving. We have 2 interns that we took on with that funding, and they are just moving beautifully through their requirements to become IBCLCs. So I'm really excited about that, because it's really hefty. It's really heavy lifting and really hard work to move someone through the process of becoming an IBCLC. But just the state's willingness to work with us, and then she came back later and said, there's a grant we can apply to together, a breastfeeding grant, and I was like, sure, but you got to give us all the money, and we have to be in charge of it. And again, she was just really gracious about that, and was open to us taking the lead as community partners. And like she said, I brought Tru in on it, and but just her willingness and her openness to redefine what partnership with community-based organizations might look like. Because I think her working with us has been a somewhat new and unique experience. And she and her team have really been open to that. And I'll let Tru speak to that question too.
Yeah, I'm totally right along with you, Hakima. I mean, I shared with Lisa that, you know, it's no secret that in the Black community, once we hear anything that has to do with the state or the county, we don't want nothing to do with it as Black people, you know, and essentially it's because of the harm and the trauma associated with the state putting on an image that they really want to help us, but you know, it just ends up being quite the opposite, where we're just uprooted and colonized and harmed. And it takes years to even get back a smidget of what we had or could have possibly had. So, I mean, initially when Hakima let me know, I was like, you know, wait, like, what does the state want to do with us? You know, this just sounds like a motive. But actually it's turned out to be quite beautiful. And I'm very honored that, you know, Lisa has been committed and has led this work through the state. And despite, you know, Hakima letting her know up front, you know, about how things need to happen, her being so strong and not taking it personal, but taking it as wisdom in a way to know the right way, the authentic way to work with communities and allow communities to lead their own work. So doing this alongside Hakima, me and Hakima, we've been, you know, what do we call it? Sister friends, colleagues. She's been my mentor over the past 5 years in various different ways. And we've upheld each other through the struggle of being Black maternal health leaders in a very white, you know, rigid state. And so that's being here with Hakima, but also being along this journey with Lisa, who's so flexible and committed to seeing change from the inside out. It's made it quite beautiful. So I'm eager to see how this work will continue for this particular project, but also how it's going to evolve, where we can really, really work with the state continuously and making sure that across the I-70 corridor, as Hakima mentioned, we're improving lives and making sure that there's access for everything that Black women and families of color truly need to not survive childbirth, but to thrive beyond it.
Thank you both for your beautiful words. I appreciate them.
You're welcome.
I think it really does take a shift in thinking, and that's something that the USBC conference really drove home. Was this is not my work. I should not be the primary person in this work. And so finding such wonderful community partners to work with, building that trust and relationship, I think has been really important. I was so glad we were able to bring you in on the ASTHO grant, and perfectly happy to hand off all of the work and money to the two of you to get done. Don't have any problem with that. Because you're the right people to do this work, and I think that's important. And that's my hope for this relationship, that we can continue to further your work, that we can spread it statewide and really help our communities that need it most to grow and thrive, and to maybe feel like the state supports them and is happy to help them.
Well, I really appreciate that, Lisa, and I'm so excited. I'm thrilled. my fingers are in a lot of pies. I'm doing a lot of projects, but the ASTO breastfeeding grant is one of my absolute favorites. I cannot wait to see the data that we get from that research project.
Yes.
We are holding focus groups around the state with Black women giving their testimonies about how well or not they felt they were served in their breastfeeding goals when they gave birth in baby-friendly hospitals. So Missouri has 8 baby-friendly hospitals. We narrowed down to 5 that we were going to do the focus groups around because the other 3 were rural and did not have significant African-American populations. So we'll go, we'll do those focus groups, not go because they're going to be online, but we will do those focus groups with Black mothers, and they will give the state input on how well those baby-friendly hospitals are doing at supporting Black mothers and meeting their breastfeeding goals. So we have some state PRAMS data that gives us an idea of what things look like now, and adding Black women's testimonies to that will be really exciting. So I'm so excited about the opportunity to work with the state and to partner with Tru and Jamaa Birth Village. But this is what we need, more of hearing Black women's voices, at the point at which they're receiving care and what their perceptions of care are, and what they think needs to change or be different.
If there's anything else you would like to add that hasn't been touched on, feel free to share.
Well, I'll share, just in my final statement about, just being, overjoyed to be in this, partnership with Uzazi and the state. I come from a very traditional and cultural background, even though I'm trained in evidence-based medicine as a certified professional midwife. I honor my cultural tradition a lot. And so a lot of healing has to take place. And, it is important that Black people lead and do their own work, but it is also important that we bring entities and institutions to the table that have caused past harm and who really don't know the absolute solutions. There's just a framework of, what they think may work. So once again, just having the opportunity to find a way to kind of heal some of the discord that could be, within the Black community in regards to the state. Like I'm really, really looking forward to that. I did get, a little bit of a shock factor when the logos came out on the flyers and it was like the Department of Health, with the organizations. And I was like, yeah, we're really doing our best to make sure that we're doing this from a racial equity lens and a culturally congruent framework, and not just, white professionals or white leaders taking a racial equity class and then saying, now we should go and do this research in the Black community. And it's like, no, so I'm just really, really happy and satisfied and eager to see what else is going to evolve and come out of this. And just want to commend, again, Lisa, but the state for even investing in it, because I know it's not easy advocating for different avenues, different ways to really improve maternal health and breastfeeding equity in the state. So, we'll see. We'll continue to see how this goes.
And even beyond the research itself, I know other states are eager to hear what the results and the outcomes of our research are, but even what we're doing here right now is a model for other states. So I feel like even in our relationship, we're leading the way and showing others a pathway to state and community-based partnerships. Because often folks are at a loss. They don't know where to begin. They don't know where the community leaders are. They can't identify who's doing the work, but someone's always there at the community level doing the work. without much support and, with no recognition. It's always being done. But the states and other kinds of organizations and institutions usually are so separate from those folks that they don't know where to begin or how to work with them or how to give way to community-based leadership. So I feel like we really served as a model for that, even apart from the work that we will accomplish together, which will be wonderful. Just learning how to come together and create these kinds of partnerships is a lesson that every state needs to learn.
And I really want to take a moment to thank Tru and Hakima both for being gracious to me, because I know that we have made mistakes, both myself and at the state level. I know that there's a lot of history there. And so just being patient with me and helping me to understand how to let you have control of these programs and working through that, I think has been really helpful, both for my department and for me personally. And I have really appreciated that.
I appreciate this opportunity for us to even share with others, what it looks like to have sisterhood and womanhood together, and to be able to allow that to manifest through our work in the community. We know how exhausting and tiring it is to not only be providers, but to be in the racial equity realm, where we constantly have to educate white people on better ways to treat ourselves. Is draining. But the fact that we keep doing it, the passion that lives through us, and how we reignite each other's flame whenever we get tired and down and maybe just feel like, look, maybe this is it. And, the way we just keep going, I'm happy that we're able to at least share that with the community, so that, they can really see what it's taken us to really rebuild what we need.
Right. Leaders absolutely work so much in isolation, and we really need one another. And the only folks in our position can understand what the day-to-day lived reality of what that is like. So just makes those friendships even more precious.
All right. Thanks, you all.
Thank you so much. And
thank you.
I appreciate you sharing all of this, and I'm looking forward to hearing more updates in the future about this collaboration and partnership. So thank you. Everybody have a wonderful afternoon, and I think this concludes our interview. So
awesome.
Thank you.
All right, bye,
thank you so
everybody.
much.
all right.
Bye.
For more information about SPAN breastfeeding in Missouri, contact Carla Voss at carla.voss@health.mo.gov.